On your mental health tonight. So the link between a popular weight loss drug and suicidal thoughts, there's a new study that's now suggesting that risk increases for people using semaglutides. I hope I'm pronouncing that right. Dr. Alice Connors-Kellgren, a clinical psychologist at Tufts Medical Center. You can confirm whether or not I'm doing that correctly.
Yeah, you got it, Maria.
Okay, good. Semaglutides, they're better known as brand names Wegovy for weight loss, Ozempic for treating type 2 diabetes. Do you have clients who take them?
I do. I actually have a number of patients who are taking these medications. So as a therapist, I always ask my patients what medications they're taking, because medications for all kinds of medical issues, in addition to mental health issues, can have a big impact on mental health. And what I've seen from my patients who are taking Wegovy or Ozempic or some of the other brand names of this drug are that they have pretty mixed results. There are some people who have experienced a lot of weight loss. They're feeling a lot healthier. Some of the food chatter and cravings that were really bothering them before have disappeared. And others either don't see results or have a lot of trouble tolerating the side effects like nausea and GI upset.
Health officials in the U.S., doctor, and in Europe say that they've investigated reports that semaglutides can cause mood changes, but they haven't confirmed a link. So what does the new research show?
So this new study that was just published in the Journal of the American Medical Association found that people who are taking these drugs are more likely to report suicidal ideation than people who are taking other drugs that treat similar problems. So the study is a little iffy because it doesn't show that these drugs are causing mood changes or thoughts of suicide, nor do they identify like what the mechanism would be. So experts think that it might be because people who have received a lot of reward from food are now missing out on this source of pleasure, but it's unclear whether these drugs are even causing the suicidal ideation, let alone what exactly is happening.
So obviously more research needs to be done here, but what's your advice, especially for people already taking medications for anxiety and depression?
So with any new drug, I really want people to be aware of the potential risks and pay attention to any changes in their mental health or in the way that their body feels, and report those changes to their doctor so that your doctor can help you figure out how to best take care of yourself.
Dr. Connors-Kellgren, thank you so much. We appreciate you. Thank you.
Thank you.